Hello everyone. This video is to make everyone aware about a group of orofacial pain disorders called as temporomandibular disorders. These are a group of around 25 disorders that cause pain in the orofacial region, specifically around the ears, in the head, in the occipital region, and in the shoulder and neck region. These pain disorders, due to their overlap with other disorders, are often confused with pain originating from the ear or pain in the head region. They're often confused with migraine headaches, tension type headaches, and other primary headache disorders. They're also confused with secondary orofacial pain disorders and very frequently confused with cervical pain problems. Since there are a number of disorders that are grouped under a common term temporomandibular disorders, so defining specific symptoms and signs of these disorders is very difficult. However, we can look into certain common presenting problems that the patient often reports. These are pain around the ears, pain in the masseter region, pain in the temporalis region, pain behind the third molars in some cases, pain in the suboccipital and the head and neck region. This pain may or may not be related to function. So some of the patients may tell you that the pain increases with movement of the jaws, with mastication, with speaking, while the other patients might not have such a relation between pain and function. Briefing about the treatment of these disorders: NSAIDs, muscle relaxants, centrally acting drugs, physiotherapy, laser therapy, thermotherapy are not indicated as treatment of choice in these patients. In fact, prescribing NSAIDs, muscle relaxants, or centrally acting drugs converts these disorders into chronic pain problems that are more complicated to handle and which take a longer recovery time. These disorders usually are treated by reducing loading over the joint by physical self-regulation, by orthotic appliances specifically designed for a specific disorder, and with the help of procedures like arthrocentesis, autologous blood injections, or in some rare cases, surgical intervention. Another point to be noted is that though these group of disorders are to be managed by a trained dentist, but the specialists treating temporomandibular disorders are rare in India. This happens to be one of the reasons why these disorders are not diagnosed and treated on time and lead to complications and debilitation in most of the patients. We, however, happen to be properly trained to treat these disorders definitively without relapses. We also happen to be faculties teaching the diagnosis and treatment of these disorders all over India. So you can safely refer your patients for a differential diagnosis and appropriate treatment of these patients. Thank you.